Facial nerve, which is the seventh cranial nerve. What we should know about any cranial nerve, its functional component. So let us say the functional component: special, visceral, efferent column. Efferent, something which goes away from the brain towards the effector organ. Visceral, particular muscle or gland. And special, which has a special type of origin or characteristics. Now in this case we have the muscle of facial expression. So these muscles are special in the sense they are derived from second pharyngeal arches, and facial nerve becomes the nerve of my second pharyngeal arches. So all the muscles of the facial expressions are derived from the second pharyngeal arch, and the facial nerve is the nerve of the second pharyngeal arch. That's why this function of the facial nerve is labeled under the special visceral efferent column. The second functional component of the facial nerve is general visceral efferent column. Again, this is efferent, which is going away from the brain. General visceral in this component has the parasympathetic fibers, which will take care of the lacrimal gland and salivary gland. All the salivary gland except the parotid will be controlled by the facial nerve. So in this we have sublingual and submandibular gland. Then we have special visceral afferent column. The special visceral afferent column, afferent, something comes towards the brain and it is special. So the taste fiber from the anterior 2/3 of the tongue, excluding the circumvallate papillae, is carried out by the facial nerve. So the taste sensation, which is a special characteristic of function carried by the facial nerve from the anterior 2/3 of the tongue. Then we have general visceral afferent column. Now this is given in few books, but it is not mentioned in the Keith and Moore, but this is similar to the general visceral efferent column, wherein the sensation from the salivary gland and the lacrimal gland is taken up towards the brain. So these are the afferent fibers from the glands. Then we have general somatic afferent column. This is afferent, so going towards the brain, and it takes general soma, means body, the general sensation from the skin, from the area where the facial nerve supplies. All the proprioception is taken up along with the sensory modality is taken up with the help of trigeminal nerve. So let us say the general sensation around the ear, face is carried out by the facial nerve, but this modality will be interpreted by the trigeminal nerve, that is at the mesencephalic nuclei. So facial nerve has these following components. First is special visceral efferent. So whenever it is efferent, it is going towards the effector organ. These are special. So special efferent fibers going to the muscle of facial expression. Why these are special? Because they are derived from the second pharyngeal arch, and facial nerve becomes the nerve of that pharyngeal arch. So it supplies all the muscles of facial expressions. General visceral efferent, these are the parasympathetic component of the facial nerve, supplying the lacrimal gland and the submandibular and sublingual salivary gland except the parotid. Then we have the special visceral afferent, afferent towards the brain, special in sense of taste, from the anterior 2/3 of the tongue, excluding circumvallate papillae. General somatic afferent, general sensation from the skin in an area around the ear and face with the help of trigeminal nerve at the mesencephalic nuclei. There is an additional component which is given in few books, that is general visceral afferent. These carries an afferent impulses from the glands.